Hey guys, welcome back to the channel. Today I'm very excited because I have a gynecologist with us today and he's going to be answering all your juicy questions. So you want to stay tuned. Don't forget to subscribe down below and hit the like button if you find value in this video. And don't forget to hit that notification bell so you don't miss any of these awesome videos. Let's get into it. Now I'm very excited to have Dr. Victor with us today. He's a gynecologist, and the reason I love Dr. Victor is that he's open, he freely shares his wisdom and knowledge on things like this, and he's going to introduce himself and tell us more about himself. So, Dr. Victor, I'm so happy to have you here.
Thank you, Lisa.
Yeah.
I'm excited to be here on the channel, Lisa Kusiima.
Yes.
My name is Victor Geek. I'm a gynecologist by training with some years of experience and with a passion in reproductive health and maternal health. I'm very excited to be here and I'll be answering all the questions that you have.
Wow, so I asked very many people on Instagram, Facebook and WhatsApp to send me their questions that they would like a guy to answer. Many times we are shy, personally, no, I'm shy, but I've brought this opportunity for you and I'm going to just go through all the questions that you've asked. The first question
Yes.
is peeing before sex. Should I pee before sex or after sex to prevent any infection? What do you have to say about that?
So that's a very good question. Many women ask me that question. Or I find myself trying to tell them what to do and what is right.
Yes.
Especially women who come in with a lot of recurring urinary tract infections. So the guidance says that women should pee after sex. To be precise, every round of sex. Because during sex, there is a chance that bacteria that is found outside the vulva can be introduced into the urinary system, especially during sex, and so one needs to void or to urinate such that they wash away this bacteria. And the woman's urethra is very short, 4 centimeters.
Okay.
That makes it easy for bacteria to be carried from the outside into the inside of the urinary system.
So every round, yes, you must look for that pee and get it out.
Get it out, yes.
Wow. So now you know. The second question.
Yes.
Is it necessary to see a gynecologist before one conceives? Because many people actually think that I should visit a guy only when I'm pregnant. What do you have to say about that?
So it's something that's expected of women to do. In the Western world, they have planned conceptions majority of the time, and they have preconception visits. And I'm an advocate of women coming to the gynecologist before they conceive or when they plan to conceive. One of the goals of this visit is to establish their health status and their partner's health, to screen them for any genetic conditions, things like sickle cell disease, which if both of you are carriers, it would be wise not to conceive. There's a high risk you might bring into this world a child with sickle cell disease, which is very, it causes suffering. So among other things, we do screen you for some inherited diseases or heart disease, kidney disease, things that might make your pregnancy hell or difficult to carry. So it's very important. And then as you try to conceive, we ask mothers to start taking their supplements, such as folic acid, because it's very useful for the development of the baby in the first trimester. Yes.
All right, so now you know, before you conceive, please come and visit a gynecologist. All right, there's one question here. Does sharing toilets actually cause infections? We all, women, we are scared every time we go to a public toilet. We're like, oh my God, I might get sick. Is it true that we'll get infections from toilets?
I'll share my experience about that. Every time I diagnose a patient with an infection, such as a urinary tract infection, they blame a toilet.
Yes, all the time.
They will think about the visit to the village, they'll think about that party they attended, the toilet they used, but I always throw this at them that I know women who live alone, use the toilet alone, and have a personal toilet in their workplace that is dedicated to them. Maybe she's a boss, and she'll still come down with an infection. So do you blame the toilet that she's using alone? It's unlikely. So we know from research that it's not likely that you will pick an infection from the toilet.
Wow.
Especially a genital infection. It's very unlikely. Most infections that we have, say candidiasis or the urinary tract infection, is caused by a bacteria that is from your anal area, from your stool.
Yeah.
It's your own bacteria that accesses your urinary system from the anal area. You know, for a woman, the anal area is very close to the vagina and the urethra.
Yeah.
So there's ease of bacteria crossing. So most of the bacteria that's causing your UTIs is your own bacteria. It's not sexually transmitted. It's not from the toilet. The things that you might get from the toilet are typhoid, maybe some diarrhea if you don't wash your hands after using the bathroom, the door handle, the tap that you wash your hands. Those are the kind of things that you might pick up from a bathroom, but not urinary tract infections.
I can't believe, but I've always blamed the toilet. So I think we need to do better. We need to be cleaner and ensure that we don't allow our own bacteria to infect us.
Yes, let me interject if you don't mind.
So
in preventing these infections, it's always advised, say after using the bathroom for number 2, I hope everyone knows what number 2 is.
They know.
When you're cleaning, always clean from forward, backwards.
Front to back.
Front to back.
Yes.
Don't clean from the back to the front.
Yeah, bringing the bacteria stuff.
Yes. And then in the Islamic world, they also have guidance for that, because they have wudu that follows using the bathroom. They also tell them if they've done number 2, they first wash the front and then go to the back. Don't wash the back and then come to the front. You're going to break
stuff.
Yeah, that's going to cause infection. So if the Islam has recognized that there's a risk of bringing infection to your urinary system, I think we all need to take that guidance.
Yeah. So now you know. All right. There is one interesting question that I want to bring. Someone here says, is it true that if my spouse, my partner is not circumcised, there's a risk of getting cervical cancer because of the foreskin? Is it true? Someone here asked.
Yes, that's very true.
Wow.
There's a risk. So cervical cancer is, I would like to just give some facts about it. It's the leading cause of death in women in Uganda.
Oh.
Gynaecologist Answers.
Oh my God.
Cervical cancer. And we know for the past about 40 years or 50 years that it's associated with a virus called the human papilloma virus. This virus is sexually transmitted. It can be carried from one woman to another. And for many people, in about 1 to 2 years of starting to engage in sex, one will find that they've already acquired a strain of this virus. You know, it has different subtypes, over 50 different types of the virus. Type 1, type 2, type 3. But the common ones that cause cervical cancer are type 16 and 18. And these can be carried beneath the foreskin. So when one circumcises, they eliminate the conducive environment that might harbor this virus. And therefore, so to say, they might reduce the risk of infecting their partners with this virus.
So, okay, if someone is not circumcised and they don't wish to circumcise, how can they prevent that? Is there a way?
Protected sex
Is the only way?
Yes.
How about cleaning?
No, you cannot clean.
You can't.
It's very infectious, and it doesn't require a penetrative sex. Yes, it just, stroking or anything, you can transmit the virus.
Wow, guys.
There's also a vaccine that can prevent. So ladies who are subscribing to this channel, spread the gospel, take your young girls and acquire this vaccine.
How old?
9 years, 9 to 12.
Oh, yeah.
It's protective. Yes, so your young girls, before they start engaging in sexual intercourse, because at one time they will do so, take them for the vaccine. There's now also an outcry that men should also be vaccinated because the same virus can cause penile cancer in men. So there's still a debate about that.
Wow, wow, wow. Oh, yes, we are getting so much information here. I hope you're learning something. If you're finding value, please hit that like button. All right. The next question. Someone says, what really is the final and true story about showering our vaginas with hot or warm water? Is it true that it's dangerous? Is it a myth?
Wow. I know here in the central, in Uganda, young girls are raised every time they bathe, they're asked to wash down there seriously, and it's ingrained in their practice that they must be clean down there. That's a very broad subject, but I'll throw some light. So the vagina is a self-cleansing organ that does not require any kind of washing. This is the vagina. In the vagina, there are bacteria that are healthy. They have acid-producing mechanisms, and this acid keeps the vagina sterile, so to say. The pH, which is acidity of the vagina, is between 3 and 4, which is quite acidic. Considering our blood pH is 7, that is more or less acidic. So when you introduce anything, your fingers, warm water, soap, or anything, you're altering the vaginal environment. You're reducing the acidity. That's what allows the organisms that cause smell, abnormal discharge to thrive. So you're eliminating the healthy bacteria and allowing these others to thrive. So what is the way that you should wash down there? The vulva. The vulva is the clitoris and the vagina open.
Yes.
Using plain water is sufficient.
Should it be warm or cold?
Either.
Either is fine.
Yes.
Okay.
The moment you use scented soap or colored soap, you're going to cause irritation down there. So you're supposed to use plain water or a very little amount of soap. That is because the vagina and the labia are very sensitive to any kind of this. I mean, whatever is used to scent and to color these soaps is not good for that area. So you cause some kind of irritation, you alter the acidity of the vagina, and in the end you're going to get infections.
Alright, so don't put anything inside there, just keep it simple and you'll be good to go.
Yes.
Okay. Thank you so much, Dr. Victor.
You're welcome.
You've given us so much information. I know we cannot exhaust all the questions, but some people may be wondering, where can I find you, Dr. Victor? And to ask more or to dig deeper in all the things that we talked about. Tell us.
Okay, for starters, I'm in Kampala, and I practice at Kampala Hospital Limited in Kololo.
Okay.
Where I handle obstetrics and gynecology, but I also have an interest and practice at Neogenesis Fertility Center, especially dealing with fertility issues.
Fertility issues, yes.
People who are trying to conceive, maybe are trying to have children, things like that. So those are the two places that I can be found.
All right. Thank you so much for being here. We are honored to have you and we are grateful. So, if you found value in this video, you've learned a lot, be sure to let me know by hitting that like button. Also, don't forget to subscribe down, click the red button below, and also turn on your notification bell so that you don't miss any of these exciting videos. My name is Kusiima, and as always, I'm here to inspire.